How do we put health at the heart of urban decision-making? We know the environment around where we live can have a big impact on health. But how do we know what is the most effective action we can take which could help people in a particular area? Take this neighborhood, for instance. We could choose to put in more cycle paths or retrofit insulation to make homes warmer for vulnerable people. Both of these interventions have been shown to improve people's health. But how do we know who will benefit the most from each option? And how do we compare, say, more cyclists with more people in warmer homes? These are the sorts of questions decision makers have to answer every day. We want to create better tools for decision makers to help plan healthier urban developments. The Trude Valuation Model offers a resource which synthesizes the evidence to give you data on how health is affected by the environment where we live, covering many different factors in and around the home. We offer a model to help you quantify and compare the health impacts of a new intervention, or to test different scenarios for options appraisal, a method to value these changes in health, including a comprehensive database of economic valuations for over 70 health outcomes. Our model is driven by changes in the environment which have been shown to have a significant impact on health. In this example, we show the environmental change of better insulation and how it is linked to changes in GP and hospital visits. We use these environment health impact pathways to forecast what might happen in another similar location. Each of these links back to one or more published medical studies. That was just one pathway in the last example, but we provide a bank of over 200 clearly defined pathways, covering a wide range of factors from air pollution to walkability. We offer a tool to help you calculate what would happen in your own target population. You can tailor the information for the specific features in your site. We then input evidence on demographics and risk of disease into our modelling to help you understand the potential for change in your site. Outputs are given in terms of comparing numbers of individual cases of illness and premature life years lost, and how to compare, say, more cyclists with more people in warmer homes. We translate these changes in cases of disease into the potential cost to society. When an individual is sick, we can measure this through premature mortality, the pain and suffering associated with the illness, lost income, and lost time. These effects ripple outwards beyond the family, across society to employers, health and social care providers, and even to educational and criminal justice agencies. The societal cost of health can be much larger than the cost of medical treatment alone. Trude gives you comprehensive economic evidence on costs for over 70 different health outcomes. Using a single, understandable metric, you can weigh up the impacts of your plans and who will be affected most by them. You can then use this information to tackle inequalities and compare health benefits with other more tangible costs and benefits for scenario appraisal. A model has been designed to complement existing tools in this area. We are similar in approach to the Manchester Cost-Benefit Analysis model, but we add in more public realm-related factors such as green space, climate change, and the food environment. By linking effects found in the medical evidence, we offer a resource to help decision-makers anticipate how much impact a change might have on a community. The heat tool does this for walking and cycling by estimating the change to premature mortality in a population. We extend this methodology to cover the wider costs of ill health as well. And by taking a societal perspective, we estimate how the burden of health falls across multiple agencies. Our approach offers more detail, a wider perspective, and a wider range of environmental factors to give decision makers the broadest range of information on urban health.